Welcome back. We are moving to S64 and we have in the sponsor of the Senate bill with us. Thank you, Senator White, for being with us. Yeah. Black and white. We always do that when we walk by each other.
You're the best cookie out there.
Yeah.
Well, thank you so much, Madam Chair. My name is Rebecca White for the record, and I represent the Windsor County District. And I am given the honor today of talking to you about S64, which is an act relating to the amendments to the scope of practice for optometrists. The reason I was compelled, just to share the personal reason, the reason I was compelled to introduce this bill is because I live in a border community to New Hampshire, and it is very common for procedures related to glaucoma, other things, to not have a in-state provider be available, and folks needing to then be referred to Dartmouth. And that is extremely, it can cost a lot more. There's a longer wait time, and potentially it's an uncomfortable place to go. A lot of my constituents would prefer meeting with their person who they've known for years rather than an outside specialist at the biggest hospital in the region. So there's a lot of reasons why I support this bill, but it's largely for the work that could be done for less money, more access, and a comfortable setting for specifically seniors in my district who are seeming to be kind of a part of the scope of practice that would be covered under this with glaucoma. The more legislative focused reason, outside of maybe my personal bias, I support this bill because the Office of Professional Regulation, which I come from the Senate GovOps world. So, and I don't really talk a lot about the medical side of things. So you all will have those conversations like our Senate Health and Welfare did. But I really look at it from the Office of Professional Regulation standpoint, OPR, which is under the GovOps purview. So we've spent significant time on this bill last session, the session before that, and again this session in different bill numbers in different forms. And the bottom line for me is that the Office of Professional Regulation felt that expanding the scope of practice for optometrists was something that they could support, and that in specific situations, they could see that scope being expanded. So, of course, you're going to want to dig into maybe laser trabeculoplasties, for example, or chalazone excisions. We didn't talk about it. We talked about what does the Office of Professional Regulation, there, see, she even knows how to say it. We didn't talk about that side of things. We really focused on like what are a scope of practice standard that we can feel comfortable with for this profession type, while also expanding access and making sure people are safe at the same time. So that's really what I have to tell you today. And if you wouldn't mind hearing from folks in our area in particular, like Dr. Dean Barcelo, there is I'm blanking on her last name, but there's also a doctor named Sheila, who's in my, she's my person. So you could have Sheila come in. There's lots of professionals in the industry you could hear from.
I just have a question for you because of something that you mentioned from the beginning. Has anyone done a evaluation of the cost at Dartmouth compared to the cost in Vermont? Because we know that Dartmouth oftentimes is about half the cost of Vermont providers. So I'm curious why going to New Hampshire, we would make the assumption that it's more costly, because New Hampshire is usually much less costly.
Oh, that's interesting. Yeah, I don't know about like the overall cost. As a personal anecdote, I've certainly found that Dartmouth is more expensive for me than other smaller hospitals in my area, but that's a procedure specific thing for me and my health insurance. So I don't have anything beyond anecdotal information. If Dartmouth is half the cost, that would be surprising to me around eye procedures. Because typically these are they have a very few number of specialists. Mm-hmm. So if there is an overall half cost for procedures, I would love to know if that specific area of like eye surgery is in line with that.
That would surprise me. It's sort of in general that we know that the cost of care in New Hampshire is about half of what the cost of care in Vermont is. That's in general across the healthcare spectrum.
But I don't know if anyone's done that. I would be very interested to know. And if you find that information, maybe you can send it to me, because then I can make the case to some of my folks who are still going to Springfield Hospital or Gifford or Mount Scottney and finding lower cost options.
Your county is
Windsor.
I'm sorry, I still have Wyndham and Windsor that I get mistaken.
Those children people, they can't go.
I know. Holy moly. Somebody gave me a hint one day that there's a south, north, up, down, or something like that, but I keep forgetting it. Are there ophthalmologists that perform some of those procedures that you were talking about? Are there in Vermont, in your county region? Or is it that they have to go to New Hampshire?
I don't know. It seems like they're being referred to New Hampshire and Dartmouth as their closest, so I don't know. There are fewer, that's the access point of it, is there's not as many as I think needed for the profession generally, so.
All right.
But I would definitely ask the folks in the field. So thank you.
Thank you, and thanks for coming in.
Yeah.
Especially on short
And I'll
notice.
just say, I've got a lovely student from Woodstock shadowing me today, so please, thank you for being kind. Health and welfare. Okay, well,
No, just
I'm
health.
gonna step out. Just help.
Yeah.
Just help here.
Welfare is down the hall.
We don't care about welfare.
Oh, yeah. Well, thank you. See you later.
Thank you, Senator.
Yeah, OPR, there's who we listen to.
Dan, you wanna come on up? Do a walk through.
Oh. Wow. It's okay, I think I haven't tried it, I just got out of it. You know when you're ready.
Working, or we might have to shut down the Zoom. All right, we're having problems with our Zoom, so we're gonna go off of live, shut down, reboot, and be back in a sec.
So the red is 0, there's 0.
Are we still live?
You know. One. Then there was 2.
We're still live. Okay, we can't even go off of live, so. We're on live.
This is what it will do.
We're getting IT accounting.
So, so there's nothing here.
Just
grab one. Did she send it to you?
Yeah, that works.
And they look so good on you, Beth.
Oh, I'm sure they do. That's what I was.
I finally went for the $89 Warby Parker, and it ended up costing me $450 each.
I don't.
Because they,
She only sent it.
you go for- I get the progressive lenses and, the other ones, the frames were kind of crappy, and before you know it,
I tried.
$450.
I'm wearing progressive lenses are $450. Never mind.
I can read so much better, but farther away.
How's the prescription for lenses?
Yeah, I would. Because
Yeah.
sometimes I can. I can't see far away. It's not.
Mine's not. I can't see so well.
Because in your eye, you see how no matter what. You know what
Going back up.
You did now? No, you're. Okay, thanks. Technical difficulties. All right, Jen, you do a walkthrough and start over again.
Great. Good morning, Jen Carvey from the Office of Legislative Counsel. I will share my screen. We will look at S 64 as passed by the Senate. This is an act relating to amendments to the scope of practice for optometrists. Prefaces by saying I'm a lawyer, not an optometrist. Some of these pronunciations, if you're wanting to get into the details. So this is amending 26 of the VSA starting with section 1703. So this is, we're in the chapter on optometry, the profession of optometry. And the practice of optometry under existing law means one or a combination of certain things, examining the human eyes and visual system for certain purposes, diagnosing and correcting anomalies of the refractive and functional ability of the visual system, and enhancement of visual performance. And I'm just doing this because we have not talked about optometrists in here for a long time.
So this language isn't the same, maybe. Oh, well, never mind.
Do not start off with 1703 and
Definitions?
definitions.
Examining human eyes for purposes.
Yeah.
Yeah, mine was
Okay.
a little different. Yeah, they're a little bit different.
Really?
This is as passed by Senate?
Yep.
Okay. Oh, well, maybe it doesn't matter. Maybe.
But,
No, it
doesn't
does.
matter. What are you getting that's different?
It's different.
Go down to line 10, or 11.
Examining human eyes and visual subs. No, that's the same.
It's the same.
Okay, never mind. Sorry.
I did print this out, I think, out of a Word document, so it's possible my margins are slightly different, but does everything,
Yeah, now it looks good. I don't know. I had a moment.
okay, but
Leslie.
we're not alone, so, okay.
No, Leslie, I think we have some optometrists or ophthalmologists who might be able to.
Oh, my brain or just my glasses?
I don't know, maybe you're having like a visual.
Optical.
237 may be able to help, yeah.
All right, so again, we've got the existing statute on the practice of optometry and what the scope of that includes. So one or a combination of certain practices, examining the human eyes, diagnosing and correcting anomalies, with certain things listed, prescribing and and this would add and administering appropriate, this would again add therapeutic pharmaceutical agents. And that's because that term is defined in this section.
Administering.
That's on
Maybe
page
I'm on the
2, I'm on
wrong
page 2.
He's skipping.
Yes,
I'm not keeping up. I'm sorry. That's my fault.
Because I'm trying to get us to where the law changes,
I got
but I
it.
wanted you to have a little context
I
first.
was too
Okay.
literal.
So prescribing and this adds administering appropriate and this adds therapeutic pharmaceutical agents as defined in this section for the diagnosis, management and treatment of the eye and adnexa. As I mentioned with the chair yesterday, that was a new word to me when I started working on this. I think it's sort of the area around the eye.
It is so.
And then under existing law, removing superficial foreign bodies from the eye and adnexa, epilating the eyelashes, punctal dilation, lacrimal irrigation, and punctal plugs insertion. These are all existing law. Managing certain types of glaucoma in patients 16 years of age or older. And then this would add, as new language, at the bottom of page 2, for an optometrist holding an advanced therapeutic procedures specialty, which is created in this bill, issued pursuant to subchapter 5 of this chapter. So for certain optometrists who hold an advanced therapeutic procedure specialty, the scope of practice also includes performing the following advanced therapeutic procedures. And there's a list, and I don't know if you want me to go through the specifics of the list or not, or just give sort of a summary.
Yeah, sort of a
Right,
summary.
Right, so surgery to remove lesions from the eye and adnexa and the accompanied restoration of tissue, including very specific excision and related processes, repair, biopsy, closure of wounds resulting from removal of a lesion, repair of an eyelid laceration of a particular size, not larger than 2.5 centimeters, not deeper than a particular muscle and not involving the eyelid margin or certain structures, and corneal cross-linking, certain laser procedures that are listed, and you'll see later there's a list of things that are not included. And the following injections. So again, this specialty would allow certain surgeries certain laser procedures, and certain injections. And then, and it says the procedures of practice of optometry does not include performing any of the practices set forth in section 1720. And that the new list that we will look at that has prohibited practices by an optometrist. So this is the list of what would be allowed for someone with a specialty, advanced therapeutic procedure specialty. Adds a definition of adverse event, which is taken from an existing definition in the hospital surveillance system chapter. Adverse event is any untoward incident, therapeutic misadventure, iatrogenic injury, or other undesirable outcome, basically something bad that is directly associated with care or services provided by a healthcare provider or healthcare facility, as those terms are defined in the healthcare administration statutes. We saw that term therapeutic pharmaceutical agent. And so this is defined as any prescription or non-prescription drug used or prescribed for the diagnosis, prevention, treatment, or mitigation of abnormal conditions and pathology of the human eye or its adnexa. This term does not include any drug or other substance that must be administered by intraocular injection or intraocular implementation, except as authorized by a particular subdivision for an optometrist holding an advanced therapeutics procedure specialty issued under the language we'll look at coming up, or any other drug or substance that is prohibited under the prohibited procedures list. Section 2 amends the renewal provisions for optometrist licenses, and under existing law, licenses are renewed generally every 2 years upon payment of the required fee. And there's a requirement for at least 40 hours of continuing education during the previous 2-year period. And the person has to hold a current CPR certification. This would add requirement that licensees holding the advanced therapeutic procedure specialty must, during each 2-year licensure period, complete an additional 5 hours of continuing education in the advanced procedures. So they have their 40 hours for their regular license and an additional 5 hours for their specialty. Section 3 has the prohibited practices. This is before we get to the rest of the specialty provisions. Prohibited practices. An optometrist shall not perform any ophthalmic surgeries with or without the use of lasers or injection procedures other than those set forth in that list of what someone with the specialties, the advanced therapeutic procedure specialty can do. And this prohibition includes the following procedures. So you can't perform any surgeries or injections except what's allowed for someone with a specialty. And this prohibition includes the following procedures, regardless of whether they have the specialty, which an optometrist is prohibited from performing. And there's a list of certain laser procedures, keratoplasties, corneal transplants, administration of general anesthesia, surgery done with general anesthesia, laser or non-laser injection into certain chambers of the eye to treat any macular or retinal disease, surgery related to removal of the eye or adnexa, including the eyeball from a living human being.
Yeah. I know, I'm sorry, it's like,
Ah, you are gonna go on this topic. Just get ready.
oh.
Surgery requiring full thickness incision or excision of the cornea or sclera other than paracentesis in an emergency situation that requires immediate reduction of pressure inside the eye. Surgery requiring incision of the iris and ciliary body, including a couple of particulars. Surgery requiring the incision or removal of the vitreous, surgery requiring incision of the retina, surgical extraction of the crystalline lens, surgical intraocular lens implants. These are all on the prohibited list.
Which is basically cataracts, right? That's what. Yeah.
You will know more than I will. Various other surgeries. I don't know how much you want me to go into all of these, but let's just say there's a list of 23 procedures and other activities that they are prohibited from doing.
Jen, can I ask you a question?
Sure.
In your experience in writing statute, I've been thinking about this a lot lately. Are there other professions that we have in statute where other than by rule, we have,
The specific,
we go into specifics of what people can do and what they can't do, including right down to the,
so I'm gonna defer your question to OPR, who has much more familiarity with the specifics of the professional regulation. I can certainly look into the statutes to tell you. I don't think I have drafted specifics, but I also, I mean, there are thousands of statutes I have never looked at or touched, so,
Yeah.
so I wouldn't feel comfortable opining.
I guess I was thinking about like health professions.
Right, even that, there are a lot of professions either that we don't do or that we haven't dealt with in this committee, or I haven't dealt with, or we haven't dealt with the parts of the statutes that would get that specific. So I think my answer is, I don't know, but I would defer to OPR to answer that, and I'm happy to look more into the statutes and come back to you with my take if that's helpful.
All right, thank you.
All right, so we've got this list of 23 surgeries, procedures, activities that an optometrist cannot do with or without the specialty. It also says an optometrist shall not prescribe or administer a drug or other substance listed as a Schedule 1 or 2 controlled substance under federal law, except as set forth in subdivision 2. And subdivision 2 says, except that an optometrist may prescribe or administer hydrocodone in combination with analgesics. So the example I'll give here is Vicodin, I believe is hydrocodone in combination with an analgesic. So that's something at least people are familiar with, provided that an optometrist shall not prescribe more than a 72-hour supply of hydrocodone and shall not provide any refills of the prescription. So in general, no Schedule 1 or 2 controlled substances with this narrow exception, and then with the exception, not more than 72 hours and no refills.
An optometrist prescribe now?
Yeah.
Oh, I didn't know that. Okay. All right.
You know, like steroid drops,
Yeah.
that kind of thing.
Section 4 amends 26 VSA Chapter 30, Subchapter 5. And what is happening here is I'm repurposing an existing subchapter and changing it to be Advanced Therapeutics Procedures Specialty. So we start out, Section 1723 is the specialty. This says an optometrist who is licensed under the regular optometry license may apply for an advanced therapeutic procedures specialty, authorizing them to perform the advanced therapeutic procedures set forth in that list in the first section of the bill of the things somebody can perform within the scope of optometry with this specialty. 1724 is the qualifications to get the specialty. It requires an optometrist to obtain an advanced therapeutic procedure specialty in order to perform the advanced therapeutic procedures that are set forth in that first section that we looked at. And it allows the Board of Optometry to grant an advanced therapeutic procedure specialty to an applicant who meets certain qualifications. They are licensed as an optometrist, so it starts out by having a regular optometrist license, meets the applicable requirements for education and demonstrated competency that you'll see in the next subsections, and has completed the examination requirements in subsection D. So for the educational requirements, it's a little bit different depending on when somebody did schooling. I think, as my understanding is based on changes in how the educational programming is delivered. So in order to obtain an advanced therapeutic procedure specialty, an optometrist who graduated from optometric school or college prior to 2019 must have completed a postgraduate course sponsored by an organization approved by the Board of Optometry that had a minimum duration of 32 hours and included the following didactic classroom instruction: instruction on laser physics, hazards and safety, biophysics of lasers, laser application and clinical optometry, laser tissue interactions, laser indications, contraindications, and potential complications, gonioscopy, or however that's pronounced,
Never see that word in my life.
laser therapy for open angle glaucoma, laser therapy for angle closure glaucoma, posterior capsulotomy, common complications involving lids, lashes, and the lacrimal system, medical legal aspects of anterior segment procedures, peripheral iridotomy, laser trabeculoplasty, minor surgical procedures, overview of surgical instruments, asepsis, and occupational safety and health considerations, surgical anatomy of the eyelids, emergency surgical procedures. I always struggle with this one. Chalazion management, techniques for and complications with local anesthesia, anaphylaxis and other emergencies that may occur in an office setting, radiofrequency surgery, post-operative wound care, and clinical or laboratory experience that includes both video demonstration and in vitro observation or participation.
Oh, okay, I have the dumbest question ever. What does didactic mean? I don't
I
even,
believe that is like classroom instruction as opposed to, I think it's classroom instruction as opposed to, yes, we'll get to the hands-on, that comes up later in the preceptor.
okay.
But this is the classroom.
So the classroom, a minimum duration of 32 hours, is that literally 32 hours or like 32 credit hours or?
I would read this as, if it's supposed to be something other than hours, then we may want to clarify that. I read 32 hours as 32 instructional hours, but 32 hours and 32 units.
Okay,
All right. So that is for, oops, I went too far. So that is for someone who graduated prior to 2019. An optometrist who graduated from optometric school or college in 2019 or later does not have to do the additional postgraduate coursework in order to obtain the specialty. My understanding is it has been incorporated into their educational program. So then we get to the hands-on part. This is the preceptorship requirements and competency demonstration. So in order to demonstrate competency for an advanced therapeutic procedure specialty, an optometrist must complete a preceptorship during which they gain at least 8 hours of clinical training that is supervised by a preceptor and demonstrates clinical proficiency with hands-on experience performing the following procedures on live human patients. At least 2 laser trabeculoplasties, at least 2 exterior capsulotomies, at least 2 laser peripheral iridotomies, at least 2 Chalazion excisions, at least 2 Chalazion intralesional injections, and at least 2 excisions or drainages of an authorized lesion of 2 millimeters or greater in size.
That was impressive.
Thank you.
How long did you
So
practice?
much more, not since the last time I walked through this bill, I'm much more comfortable with the legal language. The preceptor shall be either an optometrist with a substantially similar scope of practice who's been licensed in Vermont or any other U.S. jurisdiction to provide the advanced procedures set forth in that list in section 1 for at least 3 years, or an ophthalmologist. The preceptorship shall involve direct and in-person supervision of the optometrist by the preceptor. Preceptorship must take place in a state in which the preceptor is licensed and authorized to perform the advanced procedures. So it has to take place in Vermont. The preceptor shall certify that the optometrist has competently completed the required procedures and provide a log of the completed procedures to the board. So we've had the classroom, the didactic instruction, we've had the hands-on clinical preceptorship, and now we have examination requirements. The applicant shall successfully pass written and clinical examinations administered by the National Board of Examiners in Optometry, including the NBEO injection skill examination and the laser and surgical procedures examination, and any other examination required by the board by rule. Then we get to an advanced therapeutic procedure specialty by endorsement. This allows the board to issue an advanced therapeutic procedure specialty to an applicant who is licensed and in good standing in another U.S. jurisdiction and who has an expanded scope of practice that is substantially equivalent to or broader than the expanded scope of practice permitted by this subchapter. So somebody whose scope of practice includes these advanced therapeutic procedures or more, and has been in good standing in the expanded scope of practice in the other jurisdiction for at least 3 years. And an optometrist whose advanced therapeutic procedure specialty was issued by endorsement may serve as a preceptor in this state, so they can help train somebody else. Finally, we have some reporting requirements. An optometrist shall report any adverse event. That was another definition in section 1 related to an advanced procedure within 30 days following the event. And then this redesignates the existing provision in subchapter 5 to be part of subchapter 1. So just moving that. And the effective date, as amended in the Senate, is that the act would take effect on July 1st, 2028. This bill S64 was originally introduced in 2025, so the date had to be moved up. That is the bill.
Yeah. Nice job.
Are you sure you're not a doctor?
Jen never gets nervous. Leslie, do you have a
I
question?
realize my question's for OPI.
Right, can I speak with the committee assistant quickly before we move on? I nominate her. Oh. Should you say?
I don't know how I feel about, I mean, there's a lot of work that needs to get done. I mean, it's gonna be a class, right?
Okay.
And how we do.
Interesting, yes, it'll be interesting to see where that goes with this.
Lauren and Jen,
Yes.
so we have you on our schedule for 10:15 to essentially 10:45, which we're at now. But our witness at 11 o'clock, who's on Zoom, only has a very short window and starting at 11 o'clock. So can you guys start your testimony and then I might cut you off and then you can start back in again.
And
Is that all right?
Okay, answer the chat.
Sorry.
I will be
We'll have,
Okay with you if we both sit
yes,
together?
of course.
and I will be leaving you at 11 for another committee, but
Yes.
let me know.
I believe our witness at 11 is only available from 11 to 11:10. So
Okay.
it's a very small window. We want to make sure that we hear from them.
Good morning. For the record, my name is Lauren Hibbard. I'm the Deputy Secretary of State and I have with me.
Jennifer Cole, I'm the Director of the Office of Professional Regulation. Hello. Yeah.
Thank you so much for having us in. I'm here in large part because I was the Director of the Office of Professional Regulation before I was appointed as deputy. And this topic has a long history and one that I oversaw as director and passed off to Director Cohen. So the Office of Professional Regulation has studied optometry and scope expansion over many years. And to the chair's question about specificity in statute, it is safe to say that you generally see specificity in statute when there's something that's controversial. So, and that is true across our professions. Most notably, dentistry with the use of sedation and optometry with glaucoma, which was the last eye wars. You probably have heard about that term. That was the last eye wars before either of our time. And then this is the next iteration of optometry scope expansion. A lot of our other professions rely on the standard definition of the scope of practice. I would say APRNs is outside of those two professions is the next most prescriptive in what they can and cannot do or with the supervision of other people. And again, that's because of scope expansion. So it's where you see professions expanding.
Right down to individual procedures.
With dentistry and you know, as I'm sitting here, I'm thinking of more. Midwifery is another one. Home birth midwives is another where it's very express what's allowed and not allowed. It's really where there is concern about the expansion of scope, and it's a changing space, and the states might be different from each other, because what's happening in the remainder of our statutes is scope is really contained by what you're taught, what you're taught in your educational program, what your current training is, and the national standard of care. And so if you think about that with regard to nursing, that's very standardized. There's not a different scope of practice for RNs in New Hampshire versus Vermont. But for APRNs, New Hampshire's a bad example for APRNs, but there are states that are very conservative on what an APRN can do. And we are more broadly interpret and have elevated APRNs in this state commensurate with their training and expertise, and other states are just behind. It's the same with PAs. There's a lot of spaces where Vermont has chosen to expand scope, and other states are in that conversation, quite frankly, but behind in the conversation from my perspective, behind. And I guess that's the thing that I will say is the Office of Professional Regulation has a very important role of making sure that professionals are qualified, have the appropriate training and expertise, and maintain competence after we license them as well. And one of the ways that we do that when it's around scope is we conduct what's called a sunrise review. And a sunrise review is to determine if a profession should be licensed or if a profession's scope of practice should be expanded. And that's in Title 26, Chapter 57. And essentially, we're looking to see, is it appropriate for the scope to be expanded? And we did a sunrise report late 19 that found that we did not think that the optometrist education had enough education around these procedures to perform these procedures. Now, we had a lot of trouble in our sunrise process obtaining documentation from the optometry schools on what they were training. And that was the fundamental reason why we could not recommend to the legislature that it was appropriate to expand scope. We did not find any increased risk of harm for the states that had expanded the scope. We did not find increased malpractice cases. What we found, or what we couldn't find, was we had no evidence one way or the other of what was being taught in the optometry schools. We came to the legislature, we talked with the legislature about this, and then we were asked to look again. And the optometry schools were much more forthcoming, quite frankly, on what they were educating. And we found in 2023 that the current optometry education, and there is a divide from optometry education before a certain date and optometry education now, which is why there's two different pathways depending on when you graduate from optometry school. What we found was now there is adequate education and training around this topic if you graduate from optometry school in the United States. And we think with the path that that Jen is going to go over, the details of the bill that both Jens are going to go over quite a bit, that with that additional training, if you graduated beforehand and with the increased preceptorship even after you graduate, now that you will have the requisite training and education, and then have continuing competencies that will demonstrate that you're capable. So we feel comfortable with this scope expansion, and we actually, in this space, generally, to the chair's question, generally, we don't love a very specific list, but we feel very comfortable with the specific list and think it's appropriate for this bill.
So to that point, I mean, what I've been thinking about with this bill is there's very few professions where this prescriptive.
Yes.
Well, there's irony in that part, no pun intended. Why are we not trying to just clean up statute? I don't understand why things like this are not being done by rule and instead are being done by statute. Because, I mean, there's a list in here of yes, you can do, no, you can't do. Technology advancements are going to be made in 6 months, a year, 2 years, 4 years.
I think
this will be outdated by the time it even passes, probably.
Well, so two things. I hope it's not outdated by the time it passes, because it's taken so long to pass, get anywhere. So I think we'll all, whether we're in favor of this legislation or opposed, really when this passes, just so that we can have a pause for a minute on talking about this topic. I think that this bill before you and was able to make it through the Senate and able to be where it is prescriptive. If it was only in rulemaking, I think that the medical society, I don't want to propose, I'm going to let them speak for themselves. And the ophthalmologists would have even more concern because rulemaking is less overseen by the legislature. I mean, there is a legislative oversight, obviously, but it just is more unregulated. Well, although it's creating regulation, it's more unstructured. So I think from the two perspectives here, the competing scopes, which we will hear about, I think there's comfort in having the legislature be the referee. And I understand that that's uncomfortable to the legislature. I don't want to assume that, but that's what I would feel if I was sitting in your seat. And I think that what you can hear from us as the Office of Professional Regulation is previous legislatures gave OPR the responsibility to do the Sunrise report. And that process has worked very well over the course of time. Sometimes legislatures have disagreed with us. Sometimes they've expanded on what we've said. But for the most part, we have done the best we can at providing the legislature an independent, not profession-based perspective on what should happen. And we take that role very seriously. And so if you read our 19 report and our 2023 report, which I'll make sure the committee has both of those reports, I think you'll see that we really did our due diligence, reviewed all the information that we possibly could that was available to us at each of those times and made this recommendation to the legislature. And I think if it was the Board of Optometrists' responsibility to do rulemaking with the office's oversight, which we are independent, we have really a lot of autonomy in the statute over our boards and oversight over our boards, that just wouldn't feel as comfortable to the professions. So I think this is, I understand it's atypical in some ways, but I think this is the best path forward at this time.
I would just like to go on record as saying that I find it deeply disturbing that 180 political members of the General Assembly are put in a position to make medical decisions on procedures that we can't even pronounce.
Yeah.
Because the people that regulate occupations need a referee.
I wish that I could say that wasn't what was happening, but I have to be transparent with you, Madam Chair. That is what's happening. And I understand why you find it disturbing. And if I had a better solution, I would give it to you, honestly. It's very similar to H237. There's just spaces where professions are expanding, where this is a debate in Vermont and in the national space. And one, we need the statutes to change to reflect the expansion, if that's the direction the state wants to go. And two, there are places that there are disagreement. And I think while we're expanding the scope, and I want to have a lot of respect for the discomfort and frustration, we think it's appropriate to resolve those things here, so then we can move forward as quickly as possible and as efficiently as possible. And what I will say is you have appropriate regulation over these licensed professionals in both spaces, by the Board of Medical Practice and by OPR. And both entities understand what these procedures are, the risks and the benefits of these procedures for patients on the ground, with the assistance of our boards and professionals. And OPR is comfortable with these set number of procedures. Additionally, this is how this legislation has passed through other states, is with a set. This is not a typical legislation for this topic. But again, I don't want to be dismissive in any way of your concern.
I just want to be completely transparent on the
I
record.
appreciate
We
that.
just did a whole bill on the corporate practice of medicine, and this bill is the political practice of medicine. And okay, any questions go ahead, Leslie.
Thank you. I have a couple. So I'm looking at the Sunrise Report, the 23 version.
Yeah.
And so it looks like that you are recommending expanding scope.
Yes.
Why?
Why? I'm going to let Director Cohen answer that.
Yeah, so first of all, we like for professionals to be able to practice to the top of their profession. And so that just increases access as a small state and, with limited workforce in healthcare and across all sectors. If a professional group has the training, experience, knowledge to be able to perform, like in this case, these advanced procedures, then we like to remove those barriers and allow them to do that just to increase access. And you'll hear more testimony, I think, from the Vermont Optometric Association about access. But
That was going to be my next
Yeah.
question. Are we aware of an access problem and who came up with these lists? That was my next question.
So these lists are the procedures that are also happening in other states. So I believe right now there are 14 other states that have substantially the same list. And in the last Sunrise Report, we were asked to go through and look at every single state where this is happening. And we did that work. So you'll see in our 2023 report, it went state by state. I lost my train of thought.
Access was,
Access. Yeah, so that's where the list came from, though, is like we studied what was happening in other states. And there are other states that permit this. And then in terms of access, what we know is that there are 168 licensed optometrists in the state of Vermont.
168, you said?
Yes. And my understanding from testimony in the Senate is that there are 33 ophthalmologists who are, there may be concentrations of ophthalmologists in more urban areas, and there are more optometrists in different counties. And I think the BOA will be testifying more to that. So in terms of access, we're hopeful that it will increase access, frankly, because when you're needing eye surgery, having to travel to get a minor surgery can be a barrier for some folks. So we're hopeful that it will increase access, and with the training and education, to have the potential for increased access, I think makes sense in healthcare, in any healthcare profession.
Okay, just so,
I'm sorry, go ahead.
you said 168 optometrists and 32 ophthalmologists.
I think 33, but
Somewhere
I
in
could
there.
be wrong. BOA, I think
Somewhere
we'll
in that
talk.
range. Okay, so, and they're probably most likely at the medical center places. In your Sunrise Report, and I just know it's 258 pages, it's like, whoa.
There were a lot of attached materials, so the meat of the report that we wrote is much shorter, but we got a lot of materials from different sides and put it all in there.
Thank you. Did you come across a lot of the reports of injury? Like, what are the downsides that you learned from other states?
Right, and what we learned from other states is there's not an appreciable difference between malpractice rates or complaints with boards about injury arising from these advanced procedures, whether it's an ophthalmologist performing them or whether there's an optometrist. So that's
how we were able to find that there wasn't an increased risk of harm to
Yeah,
Vermonters.
yeah,
That's
that's
a
the
key
worry, right?
finding.
I think that's what the ophthalmologists are worried about, right? That we have this
Yeah.
advanced training and we need that in order to do this. But is that true? Is what we're being asked?
Well, yeah.
Can I expand on Leslie's and ask one more question about that? And then we're going to go to our next witness and then we'll come back to you. Did you study increased utilization in other states that have expanded?
Whether more people have had the procedures?
Whether more procedures are being done?
No, I think we did look at that a little bit in the 19 report, I believe, Madam Chair. But what we found was not more procedures, just that they were happening in different settings.
Okay.
I don't, so if the concern is that optometrists will utilize the procedures more than an ophthalmologist would, then no, we did not find that.
Or that we will be doing procedures that weren't necessarily being done before. And
I don't believe that we found, I will have to go back and reread that report to just refresh my memory, but we were concerned that there was going to be the use of these procedures when they were not clinically necessary, and we did not find that in 2019. We did find in some places that people were getting the procedures faster, and we don't know whether or not that will occur in Vermont. We don't have that data yet. But we didn't find that the procedures were occurring without good clinical justification. So I don't think you have the people in front of you with the clinical need, regardless of who's providing the treatment.
was there cost analysis?
We did do some cost analysis in 2019.
Let's go to Brittany, and then we'll come right back to you. Promise. Hi, Brittany.
Hi
Thanks
there.
for joining. Thank you so
Yeah.
much for joining us today. And I know you're on short time. We really appreciate you making time for us.
Yeah, thanks for having me. So I was asked to just share a little bit of my story. So I have a timeline that I can share and some of the things that I experienced. So sometime after October 15th in 2024, I started to develop it was maybe like a sty or something like that. I had had like a couple when I was a kid. It wasn't a big deal. And then before November 30th of that year, I really started to notice it, but it was mostly cosmetic. I wasn't someone who really wanted to like go and have my eye and my eyelid poked at. And so because it wasn't bothering me, I was like, well, okay, I can live with this. But by January 28th of that year, the following year, 2025, it had become quite large and raised, and it was beginning to like interfere with my vision. But it wasn't painful yet. But I had reached out to a plastic surgery office to be like, hey, like, is this something that I just need to have removed? Like, is this some weird sort of growth on my eyelid? I wasn't quite sure. And they told me that the best thing to do would to contact Dr. Lane's office. And because I specifically would need an ophthalmologist. I was told that like an optometrist wouldn't really be able to do anything for me because it was my eyelid rather than like my eye or like needing eyeglasses. And so I emailed them. And they let me know on January 31st that Dr. Lane wasn't available until like the end of March or early April. And I was not an established patient there. I had never needed an ophthalmologist before. And by February 3rd, it started to get infected. And by February 6th, it was quite noticeable and painful. If it would be helpful, I can share photos. It would make most people go, ooh, like, ew, that doesn't look very comfortable. And so back and forth emails ultimately got me an appointment for Valentine's Day of that year to see an optometrist. And they said like an optometrist can do an initial evaluation, but she's not going to be able to do much of anything else in terms of like treatment. So I went in, I did the initial evaluation. I believe I was given an oral antibiotic first. And then when I went in the following week, that didn't work. So they gave me a topical ointment. It may have been the inverse of that, but I met with Dr. Bowman both times. They were finally able to get me in on March 3rd for what they call like an INC, where they like flip your eyelid over and then they cut into it and they scoop out whatever it is that needs to be scooped out. The challenge there is that because it took so long, it had already started to burst through the skin of like my outer eyelid. So you could see like drainage and that sort of thing. And so the way that I described it to people is like trying to scrape something out of a tube. It's a lot harder to do that if you don't have like an edge to scrape against. And so it was puffy and inflamed, and the healing process, it did not, it they couldn't get everything out because of how difficult my case had been because it had progressed so far. So they gave me a Z-Pak on or around March 11th. I continued to have like poor healing, ongoing pus and drainage, flares of inflammation throughout April. They were able to get me into the office in early May, around the 5th, for an injection to help further break down the remaining buildup. Sometimes they do that first, but because of how much mine had progressed, they decided to do the INC first. So Dr. Lane did the injection, and it helped a little bit, but it still wasn't completely healed. And I actually have a video that I took of on June 12th showing that there was like a head to it, like it was still like coming out of the external part of my eyelid, and it would drain at times, it would scab. I took really good care of it. I bought all of the products and solutions that they told me to get. And then in November of 2025, I developed a sty on my lower lash line, same eye. It drained on its own, but then it came back, and I learned that I was like, I'm not going to let any time pass. So I called and I was like, I need to come in immediately, and this needs to be taken care of. And so they were able to get me in on December 1st, which is still not all that immediate when we're talking about early November to December 1st, but given initially that their time frame, to get me in was months, I consider that pretty quick. And when Dr. Lane was doing the injection, I showed her, like, I still have scar tissue and everything on my upper lid. It still doesn't look like my other eyelid, and it didn't look like what it looked like before. She's like, well, while we're here, why don't we just do another injection? Because the medication was open. She had the same eye, same needle. That was fine. Both ultimately healed, but I think the takeaway from that is that if I could have gotten into an optometrist where there are more of them in the state of Vermont to take care of this, I wouldn't have had all of the issues. I wouldn't have had like the pain. There was an aspect of like emotional suffering because it became so frustrating. I needed to take time off from work. There were added expenses. And so one of the things that I feel strongly about is that and I offer this, I'm a licensed clinical mental health counselor. And so I'm licensed through OPR and the Office of Professional Regulation, Secretary of State, taking the licensing exams. It's the responsibility of the Office of Professional Regulation to help ensure that people are practicing within their scope, and having the current limitation doesn't allow people who are untrained to engage in professional activities that are beyond their scope of practice. Simply because somebody is licensed, like if they're a licensed optometrist, it doesn't mean they can necessarily go and perform these procedures. They still have to be trained in it to do it. The same way that I'm not trained in EMDR, so it wouldn't be okay for me to hold a flashlight in front of someone's face and say, follow this as we reprocess your trauma. That's like an individual professional responsibility of not practicing outside of a person's scope. And so I believe that if I had earlier access to care, I wouldn't have had all of the struggles that I did. I wouldn't have needed the INC and then multiple injections and missed time from work. And so it would have been nice just to be able to go see my regular provider that I already had an established relationship with, or even someone, let's say she was busy and she couldn't get me in, somebody that she trusted. I wouldn't have had to wait months to have this taken care of.
Can I ask you a question? Just because
Yeah.
we're working on another bill, which is related to primary care.
Mhm.
And I'm wondering, do you have a established primary care physician?
Of course, yes.
Did you make an appointment with your primary care to assess this and refer you?
I didn't need a referral at that point. I don't believe that I saw her during that time. I see a nurse practitioner who's fantastic. If it's something that, like, I probably would have mentioned it if I had a physical during that time. But from the research that I did and speaking with the professionals who do the treatment, there wasn't anything that my primary care provider would have been able to do aside from the same thing that Dr. Bowman did, which was give a prescription for a topical and an oral antibiotic, neither of which worked.
Yeah, but although they do have 24 access 24/7 access to ophthalmology, which
So
they can
I-
refer to immediately.
Yes, I did try. I looked into the ophthalmology department at UVM, and there was another one, a private ophthalmologist down in Montpelier. I think I would have been able to get in with him. Actually, I think it was like around the same day that Dr. Lane's office was able to get me in. It was just a farther drive.
Okay. Any questions for Brittany? Well, thank you so much. We really appreciate you taking the time. And
Yeah.
thank you for your work, by the way.
Certainly.
We
I'm
love
gonna head.
licensed clinical social workers.
Fantastic. Yes, I'm actually gonna head into a session in just a moment.
Yes, I figured. Thank you.
Yeah. Thanks
Appreciate
all.
your time.
Bye now.
All right, can we? Okay, I'm like flipping around on the schedule today. Come on back up. I was gonna say, can we take a break?
We don't really have much more action.
Okay, you probably,
And I moved my 11:30, so I'm gonna get up and move. That little interim gave me a moment to do that, so. Thank you. For the record again, Lauren Hibbert, Deputy Secretary of Education.
And Jennifer Cullen, Director of the Office of Professional Regulation. So, you know this, you've walked through the bill. S64 expands the optometric scope of practice for Vermont optometrists through an advanced therapeutic procedure specialty. To qualify for that specialty, a duly licensed optometrist must satisfy the education, training, and experience requirements that are set out in the bill. That includes an 8-hour clinical training in these procedures with hands-on experience performing them on live human patients. And it kind of, in hearing other testimony about how this is done in other states, it surprised me to learn that they're doing it on each other. So you go to this training and sometimes the folks who are doing the training are performing the procedures on each other, which I don't know why I found that interesting, but I did. So like they're confident enough, I guess, in their coursework, frankly, to be able to say, yes, I will let you do this on me. So for applicants who graduated from optometry school before 2019, they have to do this additional 32-hour course. And it's not that the advanced optometric procedures weren't being taught in schools before 2019. I think some schools were doing it and some schools were not, or not to the same level. But my understanding is since 2019, the kind of curriculum has become more standardized across optometry schools. So that's why that date is in there. And there are some states where, optometrists have been performing these advanced procedures for decades. This 32-hour postgraduate course for pre-2019 graduates is also fairly standardized. So other states have a similar course and use a similar requirement. All applicants have to pass national written and clinical examinations. That includes a skills examination. So we're ensuring competency also, not just through education, training, experience, but also through that assessment of competency. And we have that in other professions as well. So in many professions, you have to take a test. And we require that. The fee for the credentials is $100, and there's no renewal fee. So yet. So we're not seeking a renewal fee for that. It's simply $100 when you apply.
And what I'll just say is that this is a specialty that's added on to the optometrist's license. So it's their traditional fee, renewal fee, or application fee, plus the specialty license. And when we added the specialty license concept a couple of years ago, we didn't clarify if it was just for the initial application and also for the renewal. And so we're going to have to come back when we have a fee bill to clarify that up, which is why I said yet, because we absolutely should receive this $100 in an ongoing basis, because it will have increased oversight for the ongoing period of time. But it just isn't our fee structure at this current time because of the mistakes made. Let's just name it.
Remember that next time we bring you a compact, Laura. Okay, so I'm a little unclear. So you are doing a one-time additional $100, but you have to do a thorough review of all their training, their preceptor, their collaborative agreements, or, you know, they have to work with they have to have a
Preceptor, yeah.
yes, so you gotta verify all of that. And you're doing all of that for $100 one time, even though they have to continue with CME and continue to renew, you're doing that one for free?
We don't want to. It's just that we, the specialty, no, it's fine. The specialty license fee, which applies to all of our professions with a specialty. So using the bill that was before you this morning, those psychologists who obtain the prescribing specialty will also pay that $100 fee on initial application. But we anticipate that we'll have a fee bill next year or the year after. It might be hopefully next year so that we have 2-year runway if we need it. So that, and in that bill, you can guarantee we are asking for a renewal fee for the specialty license across all of our professions that we've been using this specialty license fee for. And there's several besides the 2 that I just mentioned.
So as you know, S64 identifies specific surgical laser and injection procedures that the specialty holder may perform, as well as procedures optometrists are prohibited from performing. Advanced procedure specialty licenses must also complete those 5 hours of continuing education that the chair just mentioned. And in those advanced procedures every 2 years to renew that specialty. And in addition, S64 requires optometrists to report any adverse events that arise from performing an advanced procedure. So with those added protections within the bill, OPR supports the bill and as we've said a couple of times, we're comfortable with the training, education, experience, competency that these folks are going to have.
Any questions for? Lauren or Jen?
And we're happy, well, I'm going to say we're happy to come back.
We are.
We're happy to come back. So as you hear more testimony and
I think we might have you back, and I'm only saying that for myself because I really would like to spend some time with the Sunrise report so I can feel better about some of the questions, and I'd like to take more testimony because maybe I'll get my questions answered, but I might want to have you back in.
Before we come back, we will, depending on timing, certainly not if it's this week, but maybe next week, we can provide you high level what we found in both a synopsis, let's just say. I think there is one at the beginning of both Sunrises. So we can take those synopsises and provide them in one document for you so that you don't have to read the 200 pages if you don't have time to, which why would you have time to? And but we can give you that information in sort of a more digestible way, if that would be helpful.
Great.
Just a quick question.
Yeah, of course.
I was just reading page 7 at the bottom. It says an optometrist may prescribe and administer Schedule 1 or Schedule 2. Are they able to do that now?
Some, yes.
Oh, they are?
Yeah.
Okay.
Right, that's not added language. I said that too confidently. I needed to take that back.
One of these days, we're gonna need to do testimony for the committee on education of the schedule numbers
I know.
and what they actually mean, because they're in
So
statute a lot.
they are.
Yeah, they are.
So that is new language. That's pain medication essentially.
Yeah.
Yes, because the procedures could have more pain. I think that's why that language is there. That would be an area that we would absolutely discuss in rulemaking as well.
Yeah.
What is appropriate parameters, but yes, that is new.
Thank you.
And you will hear from an optometrist who can tell you about what she currently can prescribe and what this will allow her to prescribe. And
Okay.
again, she's the expert.
Thank you.
All right, thank
Thank
you.
you so much.
Thank you.
Thank you. All right, so we're actually done for the morning. We're gonna take the rest of our morning, we won't be on live, and maybe committee members can spend some self-discovery. I'm trying to think. No, on H237 from this morning. Maybe for those who would like to go back and reflect on prior testimony, give you a little bit of time to do that. So that's what I meant. And H237. So you don't have to do it tonight.